Greetings and welcome to the Emotional Alignment Insight series. If you're stuck in therapy, you're not alone. I have coached dozens of people and spoken with hundreds more. And the theme that arises is this: therapy isn't all that effective and it's really unreliable. I have spoken to lots of people who have gone through therapy for months, if not years, and felt that they really didn't get a lot. And other people who had to go through a whole host of therapists before they found someone that really works for them. That's what this video is about. We're going to look at the current approach to mental health care and give you more than a dozen reasons why it may not work for you. More importantly, we're going to tell you what the 4Sight model approach is and why it's a much better solution. Welcome to our video. We're going to break down the factors that talk about why the mental health care approach today doesn't work well into 5 different sections. The first section is initiation, which basically means how does this whole mental health care process get started? After that, we're going to look at analysis and the factors against that, which means how do they determine what actually is the issue? The next section is going to combine analysis along with improvement, which is how do you get better? Because some factors overlap into both categories. So after that, we'll then get into actual improvement and talk about the factors specifically to how do you get better. And finally, we're going to end up with our administration, which talks about how is the whole system managed today. In the current approach, problems are defined ad hoc. Every person determines for themselves if an issue is present. With 4Sight, we give you clear guidelines, specific categories of health that we should all maintain, with questions for each group to determine if you are doing well. We also have defined abusive and selfish behavior, so others can make an assessment. Today, with some rare exceptions, an individual decides. That means that if a person's behavior is an issue for others but not for them, help is not likely to be pursued. 4Sight works in line with what emotions enable in the first place: group feedback. After all, emotions allow us to feel pleasure and pain based upon someone else's experience. The behavior definition above enables this feedback, which means anyone can call out anyone else. In therapy now, a professional analyzes the patient as they see fit. Criteria lists may be available, but even then, whether or not a list is used or a particular item is present is up to the provider. With 4Sight, there's a very clear system for determining what issues are present for each individual. With the current system, criteria are highly qualitative, like decreased sleep. They are not easily determined. They are also not individual specific, so what might be a symptom of a problem for one person may actually be a good sign for someone else. That's why with 4Sight, we eliminate criteria that are ambiguous or left up to individual interpretation. We also invite multiple people to be included in that determination, which inherently takes advantage of the wisdom of the crowd. Therapists use arbitrary trait groupings to make a diagnosis. Part of the blame here lies with the fact that the mental health care system parallels the physical health care system. Ask any therapist to distinguish between bipolar and borderline, and you'll likely get a lot of discrepancies. 4Sight talks about the 4 social emotions: guilt, shame, fear, and worry, and looks at whether or not you are under or over-experiencing any of them. Each area in deficit is tied to undesirable behavior, which is the coping mechanism we use to make up for misalignment. This one-to-one connection is unambiguous and helpful. I don't have to tell you the stigma associated with many of the terms in today's practice. Borderline itself is like a 4-letter word, and disorder? We could do better, and 4Sight does. As you just heard, there are essentially 8 potential issues associated with the 4 social emotions, with each having a rating of mild, moderate, severe, or extreme. Again, with very clear guidelines as to how that assessment is determined. When you need treatment, you go to a private location. Granted, in today's pandemic environment, telehealth is becoming accepted. Regardless, the interactions are meant to be one-on-one, and the conversation is meant to be secret. With 4Sight, we take the opposite approach. That's because your likelihood of improvement is enhanced when you are accountable to others. So why not include them when you are working on something? The enabling factor here is terminology that is non-judgmental, constructive, self-evident, and even foolproof. After all, if you look down upon someone because of their emotional issues, or worse, use them against them, that's proof that you have emotional issues. If you're lucky enough to have mental health care, and many aren't, your copay can be low, but the insurance cost is still high. So that's no good for your employer who is actually paying for the benefit. 4Sight is built around a self-help website that is of no cost to anyone. And for those who require guidance, or for the difficult person being pushed by a group intervention, we will offer our services free if they cannot be afforded. Emotional wellness should be available to everyone, regardless of their socioeconomic background. Everyone knows that therapy is scheduled and is often weekly, but does that even make sense? After all, the biggest help is needed when you are experiencing the issue, so it's even more important that aid be on demand. Because 4Sight is inherently a shared process, your friends and family can be available when you need them. In fact, improvement can often be their sticking up for themselves when your behavior is a problem, and/or them using the right terminology as emotional smelling salts when you need them. Best of all, they will also learn about themselves in the process, which will improve their behavior as well. Every therapist has their own custom approach to treatment, and that's true for even the more tightly defined disorders. In fact, many therapists believe their skills to be an art form which requires their customization. That's good for them, but not good for you. In contrast, 4Sight has a detailed system, CORE, which stands for Commit, Observe, Reflect, and Edit, that is followed with specific thresholds you can use to know that you are progressing. After all, if you can't measure it, you can't manage it. In the current system, treatment doesn't have an endpoint. In fact, to some extent, therapists are rewarded for continuing treatment. You can become a cash cow. The issue of self-dealing is clear. With 4Sight, the improvement term is limited. In fact, we wanted to take just one session, and in the worst case, 5. We give you all the insight and tools you need early on, and spend most of the time helping you integrate that knowledge, as well as building out your ecosystem, all those with whom you interact. So you'll get the full circle, full-time level of support you need to enable change. The path to becoming a therapist is education-dominated, but that only means you have acquired knowledge. It says nothing about your ability to apply it, even to yourself. Schools do not say you are free of bias or effective in treatment. With 4Sight, on the other hand, to advocate, you have to complete the 4Sight system itself. That means you have to be able to demonstrate your ability to model reality highly accurately. In other words, your bias must be super low. Further, because improvement can be easily measured, you will know when an advocate, our term for a 4Sight provider, is effective, because you can see how all their clients have done. We track performance. In order to help someone, you need to be licensed in each state. And as with education, there is nothing to show for proficiency. They simply don't measure it, which is absurd. 4Sight itself is not only national, but also inherently international. Our metrics and criteria are built upon a behavior system that is uniformly delivered, because it is managed like a standard. Consistency in practice is paramount for us. Private education is used to train people who practice today. That means books and stand-up instruction that are not widely available or easily understandable. And given the fact that each school gets to determine its own curriculum, there can be huge differences from one school to the next. With 4Sight, we have a website where you can access everything. You never need to buy a book. You never need to have a subscription. In fact, you never even have to set up an account. Be anonymous. Use it as needed. Distribute accordingly. The United States' $225 billion in mental health care spending pales in comparison to the nearly $4 trillion we spend on physical health care, although more spending on the former would greatly reduce and get under control the latter. The main reason we're not doing that is because our current approach is stigmatized and ineffective. That needs to change. Even the National Institutes of Mental Health say that the DSM is not scientifically valid. Mental health care is a pharmacological nightmare. The current system is broken. A new approach is needed. 4Sight is here today. We welcome your feedback about this video, the 4Sight model in general, or really any questions you might have. Please leave a comment in this video section or send us an email. Thank you for watching.